Welcome everyone to the State of Queensland's Children's webinar. Thank you so much for making the time to join us today and for caring about the well-being of children and young people in the present and into the future. My name is Chris and I'm one of the ARACY's Young and Wise members, and I'll be your MC for this afternoon. For many years, I was based in Mianjin, Brisbane, on the lands of the Turrbal and Yuggera people. It's an incredible place to grow up. It was my home, it was my place of study, and it's where so many opportunities open up for me. I'm now studying in Melbourne on the lands of the Wurundjeri Wurrung people of the Kulin Nation, and I feel incredibly fortunate to have been living here and studying here as well. In saying so, I'd like to acknowledge the traditional custodians of the lands on which we are joining from today. And I pay my respects to the elders past and present, and extend that respect to all Aboriginal and Torres Strait Islander people joining us here today. And if you feel comfortable, please feel free to share what country you're joining in from in the chat. And I want to also acknowledge that an acknowledgement of country is also a moment of reflection. For thousands of years, First Nations people have used story, knowledge, and observation to guide children's learning and well-being. In today's world, we can sometimes lose sight of that bigger story of how children are really doing. Today's webinar is an opportunity to refocus that story, to ground ourselves in evidence, in lived experience, and in collective responsibility. Today, we turn our attention to Queensland using the State of Australia's Children Report to look at what the evidence says about children's well-being, where progress is being made, and where urgent attention is needed. Our goal today is to move beyond data and translate it into something meaningful, create meaningful action that improves outcomes for all children, no matter where they live or what circumstances they may be. I could speak about this for hours, but thankfully I'm joined by an incredible panel of 7 speakers who will help bring the Queensland story to life. First, I'd like to invite Michael Hogan, Executive Convener of Queensland Kids Partnership, to help set the scene for us.
Thank you so much, Chris. Chris is not only reprising his role in the launch of the State of Australia's Children Report, as he said, he's a member of ARACY's Young and Wise panel and is also a member of Queensland Kids Partnership Intergenerational Stewardship Table. So thank you so much, Chris. I am here with privilege on the lands of the Turrbal and Yuggera people in Mianjin. Thanks to everybody for joining us for today's webinar. Thank you so much to our co-presenters and partners and collaborators in coming together today. And thanks as well to the philanthropies and the hundreds of other partner and collaborating organisations and leaders across Queensland that join us in the work of our partnership. At the next slide, please. Queensland Kids Partnership, for those of you who don't know us, is an initiative of ARACY, the Australian Research Alliance for Children and Youth. We have an audacious intergenerational vision for every young Queenslander to thrive. And we also have an ambitious 5-year strategy we've just started, starting in the middle of last year, to sort of shift the dial and shift the conditions in our systems to enable young Queenslanders to thrive. And that's built around, as you can see in the slide in the middle there, 6 portfolios where we connect and catalyse and learn together with our partners and collaborators. So we've got a big agenda over the next 5 years, and that's heavily informed by what we know about what works and what we know about how Queensland kids are faring. From the very get-go, about 5 years ago, we saw good access to vital data as an essential lever for systems change. And as I said, we have an ambition for all young Queenslanders to be thriving, but we're particularly motivated and driven by the fact that so many young Queenslanders experience adversities and inequities that mean they aren't getting a fair go. And in particular, we're really keen to see what we can contribute to close the gap for young Queenslanders and for what's happening for them and what's happening for young people across Australia. one of our very first pieces of work was to develop a Thriving Kids data roadmap. And we're excited that over the last 5 years, a whole series of pieces of work have happened in the Queensland ecosystem to help fill the pieces of a jigsaw around what data we've got available to us. And so, of course, the Australian Child and Youth Wellbeing Atlas, we have in Queensland, the Queensland Family and Child Commission's Growing Up in Queensland data portal. Of course, we have the long-standing reports for Queensland on how we're going in the ADC, and we've had a series of collaborations with place projects in Queensland around data access at a local community level, and we've got QCOS doing community services data work. So we're really thrilled about having an opportunity to dive a little bit into the Queensland state of children from the national report. As Chris has said, this is so vital to inform how we go from knowing how things are going and knowing what works into doing. So we're so pleased that we've got our partners and collaborators taking us for a deeper dive into the report today. Thank you so much, everybody. Back to you, Chris.
Thank you so much, Michael, for grounding us in that broader context and reminding us why this work actually matters so deeply to millions and even thousands, and to share with us the work that Thriving Queensland Kids is doing. And now I'd like to pass it on to Adrian Erdell, lead researcher of UNICEF, to share more about the well-being of young Queenslanders.
Thanks, Chris. Am I still on mute? Can everyone hear me? You're good? Okay. It looks at mute on mine. Apologies. It's so wonderful to be here and have this conversation about Queensland kids. Thank you so much for all of your time in coming to join us. I know that for many of you working in communities directly with children, young people and families every day across Queensland, some of these challenges are likely not new. You see them firsthand, and my hope is that this evidence in the report helps validate what you're already probably observing, the importance of your work, and strengthens the case for why children need to be made a national and a state priority. I also do want to acknowledge the traditional owners of the land and pay my respects to elders past and present, and thank the Queensland Kids Partnership for organising today's webinar. So today I'll briefly explain what this report is and then focus on what it shows us for Queensland, both where children are doing well and where the gaps and opportunities remain for our collective action. To start with some context, the State of Australia's Children report was developed by UNICEF Australia in partnership with ARACY and Minderoo Foundation, and we launched the report in November last year. The report provides a comprehensive snapshot of children and young people's wellbeing across the country. The report is important for building a coherent and holistic picture of children's wellbeing. So by using ARACY's Nest Wellbeing Framework and grounded in the rights of the child, we draw on the best available data, and it brings fragmented data together, cutting across health, education, justice and housing into one coherent picture rather than treating them outcomes as silos. Importantly, there are persistent data gaps about children in Queensland and nationally that our report calls to address. The report also includes the first-hand perspectives of children and young people, over 2,000 of them, about what they need, their concerns and hopes for the future. The report centres the voices of children to help ensure they are visible in decision-making. The perspective I will share with you today is what is happening at a national and a state level for Queensland kids. But through our partnership with the CEWA, you can access and visualise more localised data where it's available. I'm really excited to hear from Marketa later on, who will walk you through that. Our ambition in developing this report is not only to measure our progress as a nation, but it is a call to action for systems change to close the gaps. Next slide, please, Sarah. The findings of this report tell us that while many children are doing well, far too many children's needs are not being met, and we have not yet closed equity gaps. So that is, not every child has an equal opportunity to thrive because some children continue to experience systemic disadvantages and barriers to resources and opportunities. We are seeing this at a national level, and the same is true for some of Queensland's children. We also need to intervene earlier and to stem emerging challenges, but we also have significant strengths to build on. So the focus for us today is to look specifically at what we know about the wellbeing of children and young people in Queensland. So I'll now talk to the overall picture, where the strengths are and priority areas for action. Next slide, please, Sarah. So what do we know about the wellbeing of Queensland children and young people? Queensland is home to around 1.6 million children and young people aged 0 to 24, including around 124,000 who identify as Aboriginal and Torres Strait Islander. Queensland has the second largest population of Aboriginal and Torres Strait Islander children and young people nationally, after New South Wales. Queensland's children are growing up during a period of rapid population growth, of rising cost of living pressures, and fast-paced technological change and environmental change, all of which is shaping their wellbeing. Overall, Queensland shows progress and strength in some indicators, that is where children and young people are doing comparatively well, that is better than the national average. But the broader picture is that across many indicators, outcomes are at or below the national average. And that tells us there's opportunities to strengthen the systems and support around children to close these gaps. The data tells us the key areas where the children in Queensland are doing comparatively well are: in the health domain, more young Queenslanders are reporting feeling happy or very happy than in other states. In material basics, more young Queenslanders are employed than the national average. In learning, school attendance is slightly above the national average. However, there has been a sharp decline nationally in the past 5 years. And more children in Queensland are achieving reading benchmark levels at year 4, about 8 in every 10 children. From a positive identity perspective, fewer young people in Queensland have body image concerns than in other places in Australia. So what does this mean? There are some strong foundations. We've got good institutions across health, education and employment in Queensland that can continue to be built on. Next slide, please, Sarah. Now let's turn to the areas that need our collective attention and where the opportunities are for achieving more equitable outcomes for all children in Queensland. Importantly, before I jump in, where poorer outcomes appear in the data, this signals systems gaps and structural barriers that we still need to be addressed. It highlights where systems, resources and supports are not yet meeting the needs of children and families across Queensland. It is not reflecting the resilience of individual children or families. The data helps identify where we need to be intervening earlier, and stronger family support is needed so all children can thrive. I'll cover some of these areas now, but won't be able to speak to them all in time, so please do refer to the report for more information. Starting with mental health, there is a rising number of young people experiencing high psychological distress that is concerning. In 2022, Queensland had the highest figures across the country, with close to 3 in 10 young people experiencing high psychological distress. Gender diverse young people and First Nations youth experience higher levels and face greater barriers to accessing safe and inclusive services. They also experience stigma and discrimination. More investment is required on preventative mental health that enhances protective factors like supporting families and reducing risk factors like bullying. Our report calls for increasing wellbeing supports in early childhood education and care services and schools. We need more funding for place-based mental health initiatives like Yeti, who you'll hear from later on today. Bullying. Many young people experience bullying both in person and online. Online safety was ranked the 3rd top concern for young people in our youth survey. Bullying negatively affects confidence, self-esteem, mental health and academic achievement. Recent national initiatives like the Anti-Bullying Review are welcome, and in the online world, UNICEF Australia has been an active voice in pushing for systemic reform that makes online spaces safer and free from bullying, including our continued efforts to establish a digital duty of care in Australia. Discrimination. Almost 3 in 10 young people in Queensland report experiencing discrimination in any year, with higher rates for First Nations youth. Last week, the Joint Standing Committee on Aboriginal and Torres Strait Islander Affairs announced an inquiry into racism, hate and violence towards Aboriginal and Torres Strait Islander people, which is a positive step forward. Homelessness. Youth homelessness rates are high in Queensland, with more young people relying on housing services than previously. Those living out of home care are particularly at risk. 1 in 3 young people leaving out of home care become homeless within a year of independent living. Youth homelessness has a wide range of repercussions, repercussions, impacting young people's capacity to finish school, to gain employment, as well as increasing the likelihood of a young person interacting with the justice system and experiencing poor physical and mental health. Improving access to stable housing, particularly those transitioning from out-of-home care, is a priority. Youth Voice is a great example of what works, which has been included in the report. The Queensland Government have also made positive policy advancements and investments towards ending homelessness for young Queenslanders. Youth justice and child protection. Children and young people in child protection and youth justice systems continue to face systemic failures that undermine their rights and well-being. First Nations children are disproportionately overrepresented in these systems, and significantly more investment is needed into early intervention, family supports, community-led and culturally safe diversionary and restorative justice measures. The Queensland Family and Child Commission is releasing a child rights report next week, and I encourage you all to read this for more information about this issue. The ongoing Youth Justice Senate inquiry is examining youth justice systems across Australia to identify the policy changes needed to better protect the rights of children and young people also. School readiness. The latest AEDC shows that just over half of all Queensland children are on track on all 5 domains, a figure which has been maintained since 2021, whereas all other jurisdictions in Australia saw a decrease of children on track. This is good news. However, the proportion of children developmentally vulnerable in one or more domains remains too high and above the national average, but this gap has narrowed. Continued attention investment to close the gap and overcome disparities, like for those living in remote areas, is critical. To sum this all up, what we know is what is around us shapes us. We know these challenges that I've raised today are serious, they're complex and intersectional, but they're not insurmountable. They require early and coordinated action that are place-based and culturally safe and often locally led. Together we know what works. I want to acknowledge the important work of so many in Queensland, from the local to the state level, including the Queensland Family and Child Commission, along with civil society, community advocates and academia, who have been shining an important light on the situation for kids in Queensland and will continue to do so in collaboration with government. Collectively, we have the will, the capability and the resources to ensure every child in every family grows up healthy, safe and supported. This report is a call to action to address the gaps that remain. The greatest impact we can have is to act now together, include young people in decision making and scale what we already know works. Last slide, thanks Sarah. For those that are interested in sharing with schools and young children this report, we do have a child-friendly version of the report that will be coming out this year, which will share more information with those when it comes. Thanks.
Thank you so much, Adrian. And there's so much that we can, I guess, take from Adrian, I guess, talking about both the progress from youth employment, reading levels, and subjective happiness to pressure points, especially homelessness, mental health, and online spaces. And if I could emphasize a point that Adrian pointed out, is to continue building on the pros, the advantages of Queensland, and to also concurrently work on covering the gaps in our systems, especially prevention and early intervention. And I guess going back into Adrian's last point, it all starts in all levels, from local to federal, so it starts across all levels. And I guess building on that, I'd like to introduce Sian, UNICEF's young ambassador, who engaged in the development of the State of Australia's Children's Report. Sian, reflecting on your contribution to the report and your own lived experience, what can you share with us about the well-being of young Queenslanders, and what's your call to action?
Thank you, Chris. And I want to start by thanking you for the opportunity to join this important conversation today. As mentioned, a little bit about me, by Chris, my name is Sian McCowan, and I'm a proud Dungari and Werribee woman who grew up on the Bundjalung lands in coastal New South Wales. But I've had the privilege of living in Queensland for the past 5 years whilst completing my university degrees. During that time, I've worked alongside children and young people through youth advocacy, community engagement, and policy initiatives focused on improving outcomes for young people. I'm currently a UNICEF Young Ambassador, contributing to national conversation on children's rights and well-being, And through this role and through youth advocacy work with government and community organisations, I've had the opportunity to hear directly from young people about the issues that shape their everyday lives, from mental health and housing security to belonging, cultural identity, and their hopes for the future. My experience has also included working with children and family policy spaces internationally. While living in the Cook Islands, I interned with the Ministry of Internal Affairs within the Social Inclusion Policy and Child and Family Protection Units. And I also volunteered with the Women's Counselling Centre to support community wellbeing initiatives. I also currently work in Nauru, which has deepened my understanding of how wellbeing is significantly shaped by systems, culture, and community supports. Across these experiences, whether working with young people in Queensland, contributing to national reports like the State of Australia's Children, or observing child and family systems in other contexts, one thing has become very clear. Children and young people understand their lives better than anyone. And when we listen carefully, we gain insight not only into the challenges they face, but also into the well-being, what well-being truly looks like from their perspective. To guide my reflections today, I'll focus on 4 key messages. 1. Data reflects lived experience. Numbers in reports like this are not abstract. They reflect the lives children are living. Number 2, systems shape well-being. Children's experiences are shaped by the policies, services, and structures around them, including housing, education, health, and the child protection system. Number 3, culturally responsive approaches are essential. Solutions must be grounded in community knowledge and leadership, particularly for Aboriginal and Torres Strait Islander communities. And number 4, young people must be partners in decision making. Children and young people are not just recipients of systems, they are innovators, leaders, and contributors. These 4 points are threaded through the voices of children themselves, which bring the data to life. Sarah, can I please get the next slide? So when we look at reports like the State of Australia's Children, we see statistics that help us understand how children and young people are faring. But the most important part is remembering that behind every number is a child navigating their world. For example, one finding showed that many teenagers identified housing affordability as one of the most pressing issues for their generation. The words of children themselves illustrate why this matters, with one child sharing, "I'm worried about not having enough. I feel sad because I feel bad for my dad because we are also getting kicked out of our house." This quote reminds us that concerns about housing are not abstract policy issues. They are daily realities that affect children's safety, stability, and capacity to thrive. Similarly, younger children often describe well-being in very simple terms, like my family and sports, or it makes me happy when I play with toys and make bracelets with my sister. These reflections remind us that well-being is rooted in family connection, play, and the security of home, which coincide directly with what is listed in the United Nations Convention on the Rights of the Child. So it is key policies and systems strengthen and address these basic rights. This leads to my second reflection. Children's well-being is shaped profoundly by the systems around them. Children grow up within environments that influence their opportunities and outcomes. These include housing systems, education systems, health and mental health services, community supports, and importantly, the child protection system. When these systems work well, they provide stability and support families. When they struggle, children experience the consequences first. In my work with young people, one message is consistent: stability matters. This is stable housing, supportive relationships, safe schools, and accessible services. Young people also emphasize that early support for families can make a profound difference. Too often, services only respond once a situation escalates. Early intervention can prevent challenges from becoming crises and strengthen children's connections to family and the community. Structural inequalities mean some children face greater barriers than others. And in Queensland, this is particularly important for Aboriginal and Torres Strait Islander children. They remain overrepresented in the child protection system, reflecting not a failure of families, but the ongoing impacts of historical and structural inequalities. At the same time, Aboriginal and Torres Strait Islander communities hold deep cultural knowledge about what supports children to thrive, strengthening community-led, culturally grounded approaches and ensuring policies are developed in genuine partnership with First Nations communities is essential for creating systems that truly support children and families. My third reflection is that solutions must be culturally responsive. Wellbeing is not only about services, it is about identity, belonging, culture, and community. Culturally responsive approaches recognize these connections and works to strengthen them. Evidence shows that when communities lead and design and deliver the programs, outcomes for children are stronger and more sustainable. This is particularly important in child protection, with strengthening families and keeping children connected to their communities reduces unnecessary separation, and supporting families early in culturally safe ways creates environments where children can thrive while remaining connected to their culture and identity. Another theme is the intergenerational nature of well-being. The experiences children have today shape the adults they become tomorrow. Children who feel safe, supported, and connected grow into adults who contribute to stronger communities. And conversely, children who experience instability or exclusion carry those impacts forward. This is why investment in children is never short term. The decisions we make today about housing, education, child protection, and social supports shape the Queensland that future generations will inherit. Finally, one of the most consistent messages I hear from young people is that they want to be a part of shaping solutions. Young people care deeply about issues like housing, mental health, education, and climate change. These are not abstract topics for them, they are lived realities. But too often, young people are invited to discussions only after the decisions have already been made. True participation requires more than consultation. It requires recognizing young people as partners in decision making, giving them opportunities to contribute to policy development, service design, and community initiatives. When young people are genuinely included, solutions are often more innovative, relevant, and sustainable. Their perspectives highlight the practical realities behind the data. So, as we reflect on the well-being of children and young people in Queensland, my call to action is 1. Listen to the voices of children and young people. Reports like this are important, but engagement must be ongoing. Number 2, strengthen systems with early support, equity, and accessibility. Services must respond before challenges escalate. Number 3, invest in culturally responsive and community-led approaches. Identity and culture and community connection are foundational to well-being. Then, recognize young people as partners in shaping the future. They are leaders, contributors, and innovators, not just recipients of services. So, the voices reflected in the State of Australia's Children Report remind us that behind every statistic is a child navigating their world, hoping for safety, stability, connection, and opportunity. The decisions we make today will shape the world that those children grow up in. Because when we listen to children, support families early, and work alongside communities, we are not just improving outcomes for today, we are shaping a more equitable future for generations to come across Queensland. Thank you, and I'll pass back to the amazing Chris.
Wow, thank you so much, Sian, for sharing, and it truly gives life to this report. It's so powerful to hear that personal perspective alongside the data. It also reminds us that every data point represents many and even thousands of stories, and that community knowledge and having lived experience are so crucial in stepping forward together. That young people are living parts, if not all, of what adults are going through in modern society. And so it's only fair to allow young people to be listened, to be treated as partners in decision making, and to have empathy to what the perspectives and knowledge of modern youth are. Next, I would like to invite Marketa Reeves from the University of Western Australia, who is joining alongside Catherine, a senior project officer, and Ria, an ACYWA, apologies, young people advisory group. Collectively, they'll unpack the connection between the report and the Australian Child and Youth Wellbeing Atlas and why looking at the state and local data matters so much.
Thank you, Chris. Thank you so much. Thank you, Sian, for your wonderful and really thoughtful insights. Also, Adrienne and Michael, for your comments. Chris makes me realise that our acronym perhaps is a little bit difficult and we should think about that. So the ACYWA stands for the Australian Child and Youth Wellbeing Atlas. And it's my absolute pleasure today to introduce you to this incredible resource and give you a short demonstration. Before I do so, however, I'd like to acknowledge traditional custodians across the whole of our wonderful country and pay my respects to them. I'd also like to say that my heart goes out to everybody experiencing and being impacted by the floods in North Queensland at the moment. And then just a couple of special mentions to Ria Lincoln. I know, Chris, you've already mentioned Ria. Ria is a member of the Atlas Young People Advisory Group. Sian, we truly believe that the involvement and the voice of children and young people is critical and incredibly important, and that's why the Atlas works with and through a Young People Advisory Group. And lastly, I'd like to thank Queensland Kids Partnership for bringing us all together for this wonderful session today. Now, I will share my screen so that we can jump straight into the presentation. I think everybody can see the platform now. Great. I can't see everybody now, but I'm sure we'll be fine. Look, what you're seeing right here is the landing page of the Australian Child and Youth Wellbeing Atlas, ACYWA. Now, I will not go through all this contextual information that is available here. You can just see in the top banner. If you're interested to read a bit more about our project, this is all available here, and also all the indicators and data that is available. What the Atlas does really, and that is the most important part, is that it links the lived experience, the community intelligence and knowledge, and all your experiencing that, you know, on the ground as working with and in services. I think Adrienne referred to this. So what the Atlas does is it enables you to link this with evidence, with robust data that goes even further than looking at data at national or state levels, but tries to shine a light, to spotlight individual data for communities and smaller areas. So we have been invited to collaborate on the State of Australia's Children Report, and so on our website you can see this wonderful purple banner. If you follow the click here button, like I'm doing so, you get to the State of Australia's Children Report page. You click on Explore the Data, and then either read the full report or you can dive deeper into it to get a more granular view of what the situation looks like in individual communities. We have chosen two to demonstrate to you today, one being educational vulnerability and the other one housing. So let me start with educational vulnerability. I'll click on learning so you can see those nest domains here for those of you familiar with ARACY's nest, which I expect most of you will be. We click on explore the data. Thinking about it. I might need feedback from, there we go. So this takes you straight to the Atlas. I will go in as a returning user today. If you are new to it, I encourage you to take the tour first. So what you can see here is the results of the AEDC 2024, the percentage of children developmentally vulnerable on one or more domains. I'm reading this from this little card here on the left. What I'll do as a first thing today is I'll zone us right in onto the state of interest, which is Queensland, like so. And I'll save this and I'll move it in the middle. So now we're looking at the results for Queensland only, and you can see all these little areas being lit up. So they are all those statistical areas too, with their individual results. Now you can do one of two things. You can just be guided by the colours and start zooming into an area of interest. Let's just go up into the north. I'm looking at Cairns. I've got quite a bit of variation here. So I can pick any area, for example, Minderoo, and what happens is you see a result panel come up on the right hand side. So this is how easy it is to access data through the Atlas. I've selected a region, I've got my results panel over here on the right. I can see that in fact 46.4% of children aged 5, so in their first year of full-time school, were found to be developmentally vulnerable on one or more domains in 2024. I can see my Queensland distribution chart and that this community sits on the sort of upper tail end of the more at-risk results. There is a theme comparison between those on track, developmentally vulnerable on one or on two, and very importantly, the time series. So we can track here, literally at one glance, you can see the results from 2009. There was a sharp increase. then a bit of a drop, and again, a strong increase in 21 and 24 as well. If perhaps I don't just want to sort of hover over certain areas, but I know exactly what the area is that I'd like to look at, users can jump into the panel here in the top left corner. Let's just go to Mackay, for example. You can choose any from here, North Mackay, and the map will fly you there. And the same thing again, so see straight away your result is being brought up. We can see the percentage of children developmentally vulnerable. I can see where that sits in the Queensland distribution chart, and I get a time series. And this is an incredible result in terms of jumping really from 21.9% and almost doubling to 41.18. So very concerning here. Quickly showing you how you can change the data selections. If you click on the data filters, you can go from developmentally vulnerable on 1 into developmentally vulnerable on 2, or you can change into on track on 5. So let's look at that one. So you see how the colors are now in reverse. We can see that in North Mackay, only just about a third of children were assessed as being on track on 5 domains. And if I zoom out, I can then see with the colours those areas where there are high percentages of children that were assessed at being on track on 5. Quite interesting here, this sort of little band of areas, and also in the hinterland. So it's not just areas around the more urban areas. If I jump into, what is that, the Central Highlands, I can see that in fact 2/3 of children and young people are developmentally on track as of the 24 results, and they have been for a number of years. However, there has been a significant increase in that percentage over the last 15 to 20 years. So see how easy it is with just navigating from one indicator to another. Now, before we go into this too deeply, I also want to show you how easily you can change indicators. So you go always just to your data filters. If you click on all themes, you see the nest domains plus environment. We've added one more, but otherwise these are the 6 domains. I will take you into material basics. Let's look at housing amenity and overcrowded housing, and let's just choose for demonstration's sake the percentage of couple families with children aged 0 to 14 living in overcrowded dwellings. See that the colours change completely. So again, I can go in and actually I will show you through the filters, just double checking we've got the latest data here. This is based on census data, so we'll leave that as is. And you can play with the colours, and if I sort of zoom into the more urban areas, whilst it all looks a little bit blue from here, but let's just look into those that kind of stand out a bit, just to demonstrate to you how easy it is to zoom into those more at-risk areas with just the colour contrast that presents. So we are here in Logan Central, and here in fact we find that close to 35% of couple families with children 0 to 14 are living in overcrowded dwellings. You can see you've got a couple of areas sitting on that upper end where that number is very concerning, and we can also see that increase between the last 2 censuses. Here again, we could change, we could look at in actual crude numbers. What does that mean? How many families are we talking about here? You see you get quite a bit of colour now. Logan Central, 150. If I click on Inala Richards, 323 couple families with children are living in an overcrowded dwelling. So a dwelling characterised by the ABS as needing more bedrooms. If you're interested in where the data comes from, you can hover over this little eye, and if you click on it, it brings you the full metadata spreadsheet with all your definitions and data access. So that's all here for you as well. Other functionality, for example, is a service overlay. I didn't show that earlier with developmental vulnerability. We can overlay with schools, health services, childcare centres, and if you click on it, it will show you what that service is. Lastly, one really fantastic functionality that was added in the Atlas update just last year, October. Here in the top left, we have a drop down, and there are, what I've been showing you today is the base, sort of the base maps. There are other parts of the map, and I will just show you the data snapshot. Here with the selection of just a couple of filters, you can download a report for each area. So you choose whether you wish to produce a report at statistical area level 2, which is the smallest level that we offer, area level 3, or local government area or local council area. For demonstration's sake, let's just choose 2. And we'll go into Queensland, and all the areas are here, but I will just show, for example, Boronia Heights. You see how quick that was? 3 filters, selected, create report, and here's my snapshot. So I can see that in Boronia Heights, incredibly high number of births. That would be one of the state's highest. The little number here is the state average, 527. That's almost 400% higher than the state average. Number of children 0 to 4, very, very high. Children with 1 or more long-term health conditions elevated. Youth suicide mortality rate is significantly higher than the state average, so also concerning. We've got here voting enrolment, interesting, often a strong indicator of connection to the community and sense of belonging in the community, very low. And the same with volunteering activity, also rather low compared to the state average. We have our AGC indicator, developmental vulnerability, here as well. The tracking here above the state average. And then we've got NAPLAN results, so that's your education results, and school attendance also tracking below 90%, in fact sitting at 88. And I think that brings me to the end of my 10 minutes, but just another reminder, so you can access the platform through the QR code in the State of Report, or you can navigate directly to australianchildatlas.com and browse the atlas. It's free, no registration required, and we always love hearing from our users as well. So if you have any questions or would like a guided tour, a one-on-one session, we're available for that as well. So please, yeah, come and explore. Thank you.
Thank you so much, Marketa, for that demonstration and for highlighting the importance of local level data. It's one thing to understand national trends, but it's also another thing to know what's actually happening in our own communities. And going back to one of Adrian's points, while some of these gaps are systematic, they can still be addressed through local solutions, and even starting at local level can make a massive impact. And to build on that, I would like to invite Helen Travers and Danielle Williams from the Youth Empowered Towards Independence, YETI, to share their local data story.
Thank you, Chris, and hello, everybody. Danielle and I are part of a small team based at YETI on Gimoy country in Cairns. And if you're not aware, YETI is a 30-year-old youth AOD service. It's a voluntary service for 12 to 25-year-olds and has a large client base, 90% of whom are Aboriginal and Torres Strait Islander young people, and many from communities in the Cape York and the Torres Strait Islands. So what our project does, Schools Up North, or the Sun Project, does, it's part of a remote capacity building or capacity development arm of YETI, which builds the capabilities of community organisations throughout the Cape and Torres to support young people. We work with, for the last 9 years, we've worked with 5 diverse school communities across the Cape and Torres to address the mental health needs of young people in particular, working through their educational experience. And so our aim is to keep young people engaged in learning, particularly in their secondary school education. Of the 2 communities we've been working with currently, our 6-year relationship with Kawanyama has enabled us to move beyond the school gate in this work to dig deep and design and implement innovative community-based strategies for engaging young people in learning in both formal and informal settings. And this has culminated in the project leading the development of the Kawanyama Youth Strategy, the subject of our talk today, which provides the means to assist the council and community leaders to address a broader set of factors impacting the health and well-being of children and young people, broader than education, and to build a capacity of young people and the community and the council to ensure not only that it's brain aware, if you like, but that young people are at the centre of decision making and have a role in council.
Next slide, thanks, Sarah. So the work we're doing with the Coanyama Aboriginal Shire Council in developing a youth strategy has come from work we started back in 2023 when we worked with the council and community to develop a context-informed needs analysis for young people in the community. The youth strategy is going to be designed to sit under the council's 4-year corporate plan, and the whole idea is to give the council and the community the means to create an enabling environment for young people through knowledge and information around data. So next slide. Thanks, Sarah. So for the Coanyama Youth Strategy, the strategy will enable the council to better guide and coordinate community action, to understand and respond to young people's needs and aspirations, to identify service gaps, especially for and ensure partners are aligned to local priorities, which is especially needed in remote Indigenous communities where the vast amount of services that are available are fly in and fly out. And above all, it'll ensure that the voices of our young people are heard and taken seriously now and into the future. But of course, to do this, data is needed. Next slide, please.
So the strategy is built around 4 key elements or conceptual tools: a model, a mindset, a metric, and a map. And the nest as the model and its 6 domains for well-being provide us with a shared way of understanding what it takes in Coanyama to build a child and youth-centred community, helping community leaders to see both the full scope of possibilities, but also very practical pathways for action. The neuro-informed mindset strengthens how we use data, recognising the powerful impact of environments and systems on brain development and well-being. Then the metric, which is still under development, is a data tool, and it provides both the relationships that we need and the relevant data to guide decisions, set priorities, and track progress over time for the 4-year implementation of this youth strategy. Finally, the map for change brings all of those elements together and turns this thinking into action, supporting council and community leaders to identify their short-term priorities within the broader strategy, but also their long-term goals and aspirations. Next slide, please. And so we feel very lucky to have met through the Queensland Kids Partnership initially to meet wonderful people like ARACY and now the Atlas, who've been helping to shape the foundations of the work that we're doing and provide roadmaps in lots of ways. And so we look at both the Atlas, the Child and Youth Wellbeing Atlas, Australia's Child and Youth Wellbeing Atlas, as building blocks really for democratising data and for enabling local sovereignty, data sovereignty. And so it is the Atlas that addresses data need at a high level, at a national level, and supports local sovereignty by producing child and youth data that's particularly accessible, which is really important to those who can make a difference. It's broad and reliable and reduces the incredible siloing and guesswork that is currently the MOU in community. And it's comparable, which is really important because it enables council and others to really target the advocacy effort with policymakers. There are lots of data gaps, but to get good, reliable, comparable data in a situation like this at local and Queensland levels in particular, supported by national closing the gap data, for instance, is really important. On the other hand, on the ground, the metric has the capacity to interact with the atlas to provide it with very nuanced local level data and to identify those critical gaps from remote First Nations communities. So while that's happening on the one hand, on the other, the metric, it's a first of its kind in providing a practical, repeatable child and youth data tool for use by local Aboriginal councils in our part of the world, North Queensland. But the Atlas has the capacity to interact and engage with the different tools that I've spoken of, the 4 M's, the metric, the model, the mindset, the map, and to assist us and to help at a national level by advocating for the recognition of the importance of local level data. Next slide, please.
And just briefly, our call to action or our next steps that we can see when it comes in this space is one, that remote communities in particular really need location-specific data. A lot of the data is only available at an SA2 level where they really need it for their individual councils. 2 is that there needs to be advocacy to government departments on all levels that they need to work on their systems to enable data sharing, so that the data gaps we see aren't just caused by a lack of working around red tape. And the last call to action we can see in our space is working collaborative on mechanisms such as the youth metric, so that local organisations and community members aren't just receiving data from places like the Atlas, which are fantastic, but also have an ability to feed up and provide local level data on what they see important for their young people. Thank you.
Wow, that's such an incredible initiative. And thank you so much, Helen and Danielle, for stepping us through what Yeti does now, and also stepping us through how data was really transformed into action. As we come towards the end of today's session, I'd like to introduce Dr. Amy Graham from Minderoo Foundation to share the key recommendations from the report, particularly in the Queensland context.
Well, thanks, Chris, and to everyone for joining and the other panelists. My job is to do this very quickly, talk about the recommendations, what they mean in practice for Queensland's ambition to improve outcomes for children and young people. So the recommendations aren't just a grab bag of ideas. They really, the team worked really hard to tell us how to move from that wealth of evidence in the report to coordinated action through stronger accountability, smarter investment that's earlier, and systems that genuinely elevate the voices of children and young people. So while the recommendations are applicable nationally, Queensland clearly has a commitment to translate these into state level decisions across budget, policy and service design and place-based delivery. So they're on screen, so I'll just speak to them individually. Recommendation 1 is really around stronger leadership, collaboration and accountability across all levels of government, and that includes appointing a Cabinet Minister for Children, a Ministerial Council for Child Safety and Wellbeing that reports to National Cabinet, and developing that National Children's Plan to unify what are currently very fragmented efforts. It's really embedding children's rights more firmly in law through the Convention of the Rights of the Child, through a National Children's Act, and that's including better resourcing for children's commissioners. So I guess the good news for Queensland is that you don't really need to wait for the other jurisdictions to catch up to act like a children first system, because you model it through initiatives like the Queensland Kids Partnership. But of course, more can always be done, especially within government, to articulate clear indicators that you want to shift, and also to better coordinate across departmental silos. Number 2 is around early intervention, and we call for an early intervention investment framework supported by a national children's data strategy, so that the investment decisions and government funding is driven by what prevents harm and improves outcomes at the earliest point, not just what responds after the crisis. Because we know that greater investment early means less money spent on avoidable costs, and tracking what works over time means that funding can flow to where it really makes a difference. So right now, we currently spend most of our money when problems are big and expensive, and we need to flip that. So an early intervention investment framework helps the government spend money earlier before problems escalate. So it looks at what works, measures results, and funds programs that improve children's outcomes, even when you can't see the immediate impacts in those outcomes. The budget mechanism embeds early intervention and ring fences that funding, ensuring that proposals are backed by evidence and measurable outcomes. An existing example of this is the Victorian Early Intervention Investment Framework. This should also be supported by a children's budget statement to guarantee sustained and equitable funding. The third recommendation is one I'm very excited about. This is for a National Early Childhood Commission to drive cohesive and timely reform so that early childhood policy and delivery aren't fragmented across jurisdictions and portfolios. So it offers that coordination, transparency and accountability mechanisms across the country. I am very excited because just in the last little while, Minderoo Foundation and our Thrive by 5 partners have been working together to put something to government to operationalise this. So we've asked the Australian government to invest $4 million in the 2026-27 federal budget to create a national early childhood education and care reform blueprint. And that blueprint is really to give government time to shape what a new entity might look like, and that's underpinned by 2 sets of principles. So I'd really ask you to get involved and think about what would Queensland like from that National Commission to help you to deliver. So you can click on the QR code to join that community campaign. The fourth recommendation, I feel like I'd be preaching to the converted for everyone here, but it really recommends elevating children's voices in decision-making in a meaningful co-design process, not tokenistic, because we know, and we've heard today, that children and young people are experts in their own lives. So we want them systematically built into decisions around service design, policy, local place-based planning, and also an evaluation of what good looks like to them. I think Queensland do that very well through the intergenerational stewardship table, bringing those children and young people around the policy-making table. Really racing here. Mental health and wellbeing workforce needs some greater support, so increasing those numbers of professionals in the early childhood education and care services and schools. And the second part of that recommendation is the National Children's Act with cabinet level oversight. So we need to meet children where they are, and we also need a rights-based approach that changes the rules of the game and reduce the drift back to reactive crisis responses. So if I could leave you with one message, it would be that all of the recommendations point to systems change, not one-off programs. And I would ask you in any of your decisions to have a bit of a checklist. Does this strengthen early intervention? Does it join up the system? Does it centre children's rights and voices? And will we be able to measure what changes? Thank you for having me. Happy to chat more at another time.
Thank you so much, Amy, for the incredible insights into the key recommendations from the report. And thank you to UNICEF, Minderoo Foundation, and the Australian Child and Youth Wellbeing Atlas team, ARACY, and Queensland Kids Partnership for bringing us together today. And thank you to all the incredible panelists for their insights. And what stands out to me is that this report isn't just a collection of statistics, it's a call to act with intention, collaboration, and urgency. The data tells a story, but what happens next is all up to us. The webinar recording will be shared on the Queensland Kids Partnership website and will circulate links after today. If you haven't already, I truly encourage you to subscribe to Queensland Kids Partnership and ARACY newsletters. Explore the full State of Australia's Children Report and dive into the Atlas platform. And finally, connect with the Queensland Kids Partnership team to continue the conversation about how you can engage, because together we can do things better. So every Queensland baby, Queensland child, and Queensland young person has the opportunity to thrive. Thank you again for being here, and let's make a positive change together in the present and into the future for young Queenslanders.